Hi, I'm Dr. Ruchi Vaidya, Assistant Professor and Nutritionist at Ramaya International Center for Public Health Innovations. We get energy from the food that we eat. To be more precise, the macronutrients present in the food, mainly carbohydrates, fats, and protein, fuel our body. This video, let us discuss carbohydrates, different qualities of carbohydrates, and their role in managing blood glucose levels. Carbohydrates, briefly termed as carbs, is the popular terminology used in the world of diet. What comes to your mind when you think of carbs? Rice, chips, potatoes, bakeries, and so on. The person on a diet or a healthy regimen is asked to cut their carbs. As they say, cutting carbs help to lose weight. So let us understand what carbohydrates are, and are they always bad? As I mentioned before, carbohydrates are the primary fuel of our body, and our body needs some amount of carbs daily for energy and basic metabolic activities. How does it work? So carbohydrates are large molecules. They break down into glucose in our body and it gets further released in the blood. The glucose is later absorbed by different cells to get the energy. By now you know that glucose in the blood comes from carbohydrates. Therefore, carbohydrate plays a crucial role in managing the blood glucose levels. There are good quality carbs and bad quality carbs. Good quality carbs are called fibers and are present in whole intact foods. When we consume fiber, it delays the process of digestion. For example, this is your stomach and intestine. And when we consume fiber, it slows down the journey to reach the large intestine and the small intestine, and it will release only few amount of glucose. Good carb foods or foods rich in fibers are whole grains, whole pulses, raw vegetables, and fruits. The consumption of these foods may release glucose slowly in the blood, and incorporating them into the diet helps to manage your blood glucose levels in diabetes. On the other hand, refined carbs or the processed carbs get rapidly digested. For example, when we consume refined or processed carbs, it will just finish the journey fast and it will release a lot of glucose in the blood at the same time. So this may increase the blood glucose levels in the body. What are these refined or processed carbs? They are mainly those foods which have undergone some process or have been polished or refined in an industry. For example, sugarcane undergo process to form sugar. Wheat undergo process to form wheat flour or refined maida flour. Rice undergo process to form polished white rice. So all these processed foods are considered as refined carbs, and this lead to rising blood glucose levels. It is essential to keep a check on the quality of carbohydrates for a person with diabetes. Instead of counseling the patient on what to eat and not to eat and providing them a list of food, if we make them understand the role of different carbohydrates, mainly fibers and refined carbs, and how they help in managing the blood glucose levels, I assure you may get a better compliance and it will become easy for them to pick up the correct choice. There is a measurement to check the quality of carbohydrates in food, and it is termed as glycemic index. Different foods have different glycemic index based on their speed to release the glucose in the blood. I will discuss more on it in level 2 and level 3 of the course, as it is not the scope of this video. To conclude, a person with diabetes has to take care of both quantity and quality of carbs in the food to effectively manage their blood glucose levels and thereby prevent complications in diabetes.